Yeah, I mean, anti-aging is a complex area, and I would say to people, you know, you cannot fix your skin with a scalpel, and the aging process is continuous, so you've got to be working on it continuously. And there are really good things you can be doing to keep the aging process at bay that's going to reduce your need for surgery in the future. I'm not saying need, it's the wrong word. No one needs cosmetic surgery, but a lot of people want it these days. So, I mean, anti-aging is a whole process, and I mean, if you're serious about it, you know, you have to actually start in your late 20s, early 30s. I mean, I think there is an overuse of injectables in a population that simply is using them too early. Most people in their early 20s really don't require injectables as a prevention. I mean, at that stage, they should be using skincare and staying out of the sun as an option. But certainly there are things, little things people can be doing, particularly light treatments, broadband light treatments as they start to age in their early 30s, laser procedures, and keeping those up at regular intervals combined with skincare, and as volume loss in the face kicks in with some fillers, can certainly you know, keep people looking younger for longer. And then surgery is something to consider once all those non-surgical options actually don't work anymore. And in that population, you know, I see fillers and the Botox being overused. I mean, for example, if you're a 60-year-old lady, you simply can't compensate for a facelift by having a face full of filler. There's a misconception that it lifts. Well, yes, if you put 10 mils into someone's face, you are going to get a lifting effect, but they're going to look different, but not necessarily better. So at that point, I will often say to people, well, unfortunately, you're beyond being able to get any reasonable result with fillers. Either do nothing or commit to surgery. And you know, some people at that point don't want to spend on a facelift, and that's fine. But I think it's important that people are not offered options which simply don't make them look younger. They just look different. And I see a lot of that around here, and it's disappointing because when you tell people you're a plastic surgeon, people assume that you're responsible for all the weird people walking around. I'd like to think that I maintain the philosophy, look refreshed, not ridiculous. That's what I've always maintained, and I hope that, you know, patients find that if they come to me, they're not going to end up looking unnatural, because the greatest fear I think people presenting for particularly the non-surgical facial rejuvenation is that they're going to look strange. And a lot of patients confuse fillers and Botox and what's responsible for an odd appearance. And actually, for people that are interested, I have a regular segment on my Instagram page where I analyse weird celebrity faces and what they've done. And often it is just a few really poorly placed injectables that have made them look weird. It's important for people to bear in mind poorly done injectables can actually look worse than well done surgery and much more obvious. And that's the reason I offer everything in my practice, so then people can be offered what they actually need rather than just one or the other.